Go on, start.
Okay. I'm happy to show you some pictures that were obtained from internet services. They are legit and they were accessible, and so I copied a lot of them. One of them I did photographs of a patient that had been in the facility some while back, and I was so proud of that because the physician had ordered dressing changes 3 times a day. Can you start over again?
Okay. What the heck? Okay.
This is Carol again, back with you. I just finished explaining the contents of our wound care kits, and they're available to you on each unit. Some of the pictures that are available, if you want to see them online, are quite gross if you look at them long enough. But these are also, many of them are available to the public, and I'm using them to show you how to choose the dressings that might be appropriate for these situations in our hospital. The first set of pictures, however, are ones that I took myself on a patient with her permission. She had a wound thigh from excessive injection of illegal drugs, and she had quite a crater. It was at least 1 centimeter deep, if not more, and the doctor wrote orders for her to have wound care changes every day for 3 times a day. And I said to myself, this doesn't make too much sense. We've got the bio-occlusive dressings, let's use those. So I explained that to the patient, and I said, when you go over to the other area where you do your day treatment program, I said, I'm going to dress this now before you leave in the morning, and don't have anybody take this off, and I'll see you again tomorrow. We'll just take a look and see if the dressing is still intact, because these dressings are absolutely valid to stay in place for 2, 3, up to 7 days on the Acticoat, the silver line dressings. So the big crater at the beginning, and then 9 days later, approximately, no, 8 days later, it was leveling off. And the last picture shows that this crater has completely normalized to the skin surface surrounding it. So all of the cells that are helping the skin to reconnect, the matrix, the fibrin, you don't want to disturb that by continually changing these dressings or putting hydrogen peroxide on that, for heaven's sake. Please don't do hydrogen peroxide on an existing wound that's clean but needs to regenerate the tissue. That would be an absolute terror to the wound itself, and you want to keep the body's own nutrients going and the moisture in there. So no heat lamps for this wound. That was really an old remedy, and I can't believe what kind of principle we used heat lamps on existing decubes. All right, then these are from internet, but I'm showing you a suture line, and over that suture line there may be, you know, small areas that haven't quite mended together, and you don't want that open to infection or microbes of any kind. So what is most probably the best choice for that particular suture line would be a dressing like this, the Elevin Thin. Of course, this would be too small, but we have a larger size, and you would put that neatly over this whole patch and just wait until the doctor says, well, it looks like the sutures are ready to come out. So don't disturb that area. And it also helps the patient to not pick on the sutures, of course. There is a second picture here on the bottom, which shows this patient may have come into the facility with steri-strips already in place. And the same principle holds on, that you've got some little lines in between the steri-strips, which keeps the edges approximated, that's fine. But then you want a little thin skin to put over that, and that would be the Elevin Thin again, as large a size as you have to cover this whole area. So that's 2 uses, 2 areas that the Elevin Thin would be useful for. Then skin tears. If you've got some older folks or they've been on Coumadin therapy, blood thinners, it's not uncommon to see hands with skin tears and arms. You know, this particular skin tear has the flap, and it's measured here, as you can see. The measuring device. But the flap, you can leave that in place. I mean, it will naturally disintegrate and come off. But underneath that is the fibrin. And so you want to cover that, again, to protect it from any microbes coming in. Use your Elevin Thin for that. And if you don't have a skin flap, same principle, provide a protective layer, the skin that we have, the Elevin Thin, to put over. Okay, then this type of problem, this is a swollen lymph node, and who knows what's underneath there. It's at the neck, and that person, you know, might have a tendency to kind of pick at it or probe it or want to do that, and who knows when it's going to burst. It looks like it's ready to burst right now. In our facility, we've got double rooms. We don't want people to be taking showers and this abscess is going to burst. It's a lymph node that's swollen. So the appropriate type of dressing would be the foam Elevin adhesive. So put the skin prep around it, and you'll need a little room for it to, you know, be accommodated for the height. But this would sit nicely, and leave it alone for 2-3 days. And if you've got some bursting occurring, and it looks like the dressing is saturated, yes, then you can change the Elevin foam adhesive. Similarly, this would be a swollen area. Who knows what kind of contaminant is in there. A spider bite is actually shown here. And you've got the erythema and the edema. You've got you know, probability of that bursting. So your foam adhesive is going to do you a good thing to place that on that finger. You'd probably want a smaller one, whatever can fit on there comfortably. Then we have another product called Hypafix, and you can cut a strip of this, and it will help the foam adhesive to sit there. The Hypafix is a wonderful impervious dressing that people can take showers, and that dressing will stay on very wonderfully. Neck burn. Okay. Here we have an example of somebody, whatever, was traumatized, again, at the neck, quite a large area. We have the Acticoat. That would be ideal because there would be several different degrees of burn created there. You've got the dried tissue, and then you've got maybe the second-degree burn. It probably is not more extensive than a second-degree burn, but the Acticoat will help that to heal very wonderfully. Leave that in place for 3 to 7 days. Now, this is an example of wounds that we probably can't treat outrightly. Our limitation in psychiatry is that we don't have a little surgical suite, but if we do have the tools to do some of the trimming of the eschar, some internal medical consults might be capable of doing that with appropriate tools. Otherwise, we will have to send this person to a medical facility where they can trim the eschar, and then underneath will be the tissue that's going to take its time to heal, and we would deal with what that tissue looks like later. But don't try to treat this by putting a dressing over it. It's not going to work. It needs to be excised. Another traumatic type of wound here that shows purulence is, it looks like maybe someone had cut themselves or had an abrasion from some area, could have been a knife or whatever, and they've left it untreated, it looks like. So with that type of problem, it seems as though the patient might have to be started on intravenous antibiotics, depending on what else is happening in the system. But there's some extensive drainage going on, and don't try to do that with our existing dressings. You may need to have some internal medical consult and have the person treated elsewhere. The last kind of wound that I want to identify, we may have elderly patients that have venous stasis, and their legs may look extremely excoriated, and you don't know what to do with this. It's weeping. Again, that would probably exceed the capability of our facility to treat. This particular patient was actually treated in a hyperbaric chamber in Orange County, in California. So this is the before picture. You see all of the horrible network of skin that's just ready to slough off, and you don't know what's underneath the infection status and everything of that patient. But after a couple weeks of hyperbaric chamber treatment, this is how the wound looks after that. So quite a contrast. Again, don't try to treat that in the psychiatric facility without having some expert consult and possibly sending the patient out from the psychiatric facility. The last item, and I had already alluded to, is the Hypafix. Hypafix is wonderful to help to adhere patches that we might have patients getting. Here in our facility, we have like Lidoderm patches, we might have clonidine patches, and nicotine patches. And patients sometimes, you know, they go to rec therapy, they're sweating, whatever, my patch is falling off. Well, instead of just issuing a new one, you can put this Hypafix. It's legit to cut a strip and place it over that patch until it's ready to be exchanged for a fresh one. So that also helps conserve your medications. We don't just, you know, give them a new clonidine patch because their old one fell off. So help them with their cost containment. And that's why we have these product lines. So it's been my pleasure to present to you the variety of products from Smith & Nephew. And if you have any questions, please call your supply department, see if you can get your box filled again, or you can call me at my extension on the unit that I work. Thank you for listening.